Hey, this is Dr. Dwain Woode from Diabetes and Endocrine Wellness Center and the Light Away in Huntsville, Alabama. In this episode, we're going to be talking about viral hepatitis. Let's get started. Well, welcome back. We're going to be talking about a very important infection, really, that affects the liver. We're talking about hepatitis today, and we're going to be talking about viral causes of hepatitis. But before we get there, if you've not already done so, go ahead and hit our subscribe button and hit our bell so that you'll be notified of new videos that we put out. Give us a thumbs up and share this video with your family and with your friends. We thank you for being here to watch this one. So viral hepatitis. Well, before we get there, let's talk a little bit about hepatitis. So hepatitis, the word hepatitis, if we break it apart, hepa meaning liver and itis meaning inflammation. So we're talking about liver inflammation or inflammation of the liver. There are several causes of hepatitis or inflammation of the liver. Anything from cancers, infection, which we're going to be talking about today. Certain medication can cause it, like acetaminophen. Certain disease processes, fatty liver. You've heard of non-alcoholic steatohepatitis. All those things can cause inflammation of the liver. But today we're going to be talking about the viral causes of hepatitis. The liver is a large organ that sits in the right upper quadrant, right below the diaphragm. And its main function is to process medications, toxins. It gets blood from the GI tract. It processes it. It metabolizes what it gets from there. It breaks it down, detoxifies it, and then prepares it either to be excreted in the urine or in the feces. And so as you see, the liver is a very important organ as part of the body. The liver is made up of lots of different cells, but the most important cells in the liver are called hepatocytes or liver cells. Hepatocytes. Yeah. And so hepatocytes are the functioning machinery of the liver. And what happens is that certain things can get into the liver cells, those hepatocytes, and can cause damage. One of the things that can do that, and we keep saying the word, viral hepatitis. And there are actually 5 viruses that we're going to talk about, and they are named hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. That's right. These viruses get into the cell and uses the cell's own mechanisms to begin producing more of themselves. And 2 things happen in that case. One, because there are so many of these virus components that are being created, you could think almost of this cell like a balloon. And as the virus replicates, the balloon gets bigger and bigger and bigger and bigger, and soon the balloon breaks open. And that's one of the ways that the virus can destroy the cells that are the workhorse, if you will, of the liver. The other thing that happens is as those cells, those viral particles, are using the cell's own mechanism to replicate, to make more of themselves, the body realizes that something's going on. And the body sends its mechanisms or its fighting cells to see what's going on, to try to encapsulate, to try to decrease the replication that's going on. And so the body then begins attacking those same cells because the cells are seen partially as foreign. And this is called an autoimmune disease when the body begins attacking itself. So not only are those cells growing and they're breaking open, but they're also being destroyed because the body's mechanism for fighting, right, which is what it's supposed to do, the body's mechanism is also causing damage. So that's how the body responds, and that's how the cells cause their damage. That's how the virus causes its damage. So like I said, there are 5 different viruses, and we're going to go through those. We're going to group a couple of them together. So hepatitis A, right? We said A, B, C, D, and E. Hepatitis A and hepatitis E, we're going to talk about those together because hepatitis A and E are transmitted in the same way, by ingesting contaminated food or water. So these viruses exist in the feces. And if you eat food or drink water that's contaminated with these viruses, then those viruses get into your body and they begin to cause the damage that we talked about. Both of these hepatitis viruses can cause acute illness. So once you get them, you begin having acute illness. So this is a good spot for us to talk about what the symptoms are of hepatitis. Well, let's go back to how the virus works. We said that the virus gets into the blood, it gets into the cells and begin to cause damage. Well, what types of things do you think would begin happening if we have inflammation, and an autoimmune disease process going on? Well, first of all, we probably have some fever, right? So inflammatory process begin having. We have the fever. So people begin to feel kind of malaise, kind of feeling tired and weak. They may begin having nausea, right? Because the bowels are not functioning well. They can have some diarrhea even in certain cases, particularly in the viruses that we talked about, hepatitis A and hepatitis E, right? People can also have jaundice. So what begins happening is because these liver cells are breaking open, right? Some of the things that are going on that are supposed to be going on in the cells are not working well. Like what? Well, bilirubin is also being processed in the cell. And now that's not happening. And the bilirubin is being excreted, right? In other ways, it's not being brought into the correct form. Conjugated is what we say. So that bilirubin begins to leak out in the urine. And if it's leaking out in the urine, right, it has a dark color to it. And so what happens is the urine becomes dark. Okay. You've seen people who have kind of a yellowish tint to their skin. That's called jaundice, right? Because they're having the bilirubin that's going into their skin and causing that pigmentation. You've also probably seen people that have kind of a yellowing to their eyes. That's called scleral icterus, right? So the yellowing of the eyes because those substances are going into the eyes as well. And normally those urobilinogen, that's another substance that's in the body, usually gets excreted in the stool. That's what gives stool its kind of brownish color. Well, if you take that pigment out of it because that stuff is not getting there, what you see is that the stool becomes clay colored. Now, I live in Alabama, and a lot of people are going to say, wait a minute, Dr. Woode. We don't see any clay colored stool, right? Because in Alabama, we have red clay. That's not what I'm talking about. So that looks almost like blood. What we're talking about, kind of the gray clay, that's what the stool begins looking like. So all these things can begin happening. Now, the other thing that happens is as the inflammation is happening in the liver, right? Think about this. If you came along and I took a hammer and I hit your thumb, right? You get some trauma to the thumb, some inflammation in the thumb. What begins happening to the thumb? It begins swelling. Okay, so the same thing can begin happening to the liver because the liver is becoming inflamed. And so we get an enlarged liver. Okay, and that's called hepatomegaly. So a big liver. And if you think about it, as the liver grows, it begins to expand. We said it's in the right upper quadrant, right below the diaphragm. What do you think begins happening? That's right. You begin having some pain. And so those are all symptoms, and the symptoms come directly from what's going on in the liver as these viruses are causing damage in the liver. The final thing that begins happening is over time, because you have this chronic inflammatory process going on, because you have this autoimmune process where the body's fighting against the viruses, you can begin getting scarring on the liver. And that scarring is called cirrhosis, right? So liver cirrhosis can occur because of the inflammatory process, because of the damage that's going on in the liver. And so the liver is one of the organs in the body that can actually begin replicating its cells. So the liver, in response to all the damage that's happening, begins to replicate. And those cells are growing because it's trying to fight and it's trying to regenerate itself. Well, whenever you have cells that are rapidly turning over, you have the potential to have one of those cells not go through the correct process and begin to grow abnormally. And this is called cancer. So hepatocellular carcinoma can occur as a process because of the damage that we're seeing in the liver. So let's go back and let's talk about these viruses again, right? So we said A and E, we're going to group together because they are transmitted in the same way, right? Fecal oral. So ingesting contaminated water, ingesting contaminated food, okay? So how do we prevent first, and how do we treat? Number one, the first thing that we want to do to prevent the transmission of these diseases is to make sure that we are having good water, clean water, and food supplies. Clean water and food supplies. There is a vaccine for hepatitis A, but there's not a vaccine for hepatitis B that's commonly available. So the vaccination will help prevent hepatitis A. It will not help prevent hepatitis E. But having clean water, clean food. If you are traveling to areas where there's not good sanitation, where there's not good water or clean water, you want to make sure that you are boiling or not ingesting local water, drinking out of bottles. You want to make sure that you're boiling water. Make sure you are cooking food. Hepatitis E, in particular, has been shown in some outbreaks to come from uncooked meat, deer meat, uncooked pork, or poorly cooked pork. Those are all things that can cause the transmission of hepatitis A and E. Both of these, like we mentioned before, cause acute illnesses. So people will have the symptoms that we talked about: malaise, fatigue, fever, maybe some joint aches and joint pain. But most of the time, the effects of hepatitis A and E resolve for most people. There are certain people that can go on to have chronic disease. They can also go on to have fulminant hepatic failure, and that can cause death. Hepatitis E is of particular importance in pregnancy. So pregnant women who contract hepatitis E can have severe complications. So many of the symptoms that we just talked about only show up after the incubation period of the virus. And that means that the virus has been in the body long enough to replicate itself and to begin causing the symptoms to show up. So for hepatitis A, the typical incubation period is about 30 days, 28 to 30 days, but it can occur as soon as 15 days. For hepatitis B, it's about 3 months or 90 days. And then for hepatitis C, it's anywhere from 2 weeks to 3 months. So now let's turn our attention to hepatitis B, C, and D. All of these we're going to group together because the ways that they're transmitted are the same: through blood or intimate contact, or can be transmitted at birth from a mother who's infected to a newborn. All of these viruses will cause an acute illness, and all of them can go on to cause chronic illness. And as we mentioned before, in the chronic illness, we can see cirrhosis, liver cirrhosis, and we can actually see cancer developing. Hepatitis B, like hepatitis A, has a vaccine that's available. And so the recommendation is that to prevent the transmission of hepatitis B, that people get vaccinated. What's important about hepatitis D is that you cannot get it unless you're also infected with hepatitis B. So those two go together. So one way of preventing hepatitis D is to make sure you do not contract hepatitis B. And what did we say before? One way of making sure that does not happen is to get vaccinated. So let's talk specifically about hepatitis B. Hepatitis B causes an acute illness, but it can also cause a chronic illness. And the risk of developing chronic illness is based on age. So people who have an infection at a young age are more likely to develop chronic disease. And people who are older when they contract hepatitis B are less likely to have the chronic disease. In fact, about 25% of those who contracted as a child and 15% of those who contracted as an adult go on to develop chronic illness and can have significant mortality. As we mentioned, there is a vaccine for hepatitis B, so the best protection against hepatitis B is to get vaccinated. So for hepatitis C, although it is transmitted in a similar way, the most common way that this is transmitted is through intimate contact and sharing of drug paraphernalia, particularly the needles. Globally, there are 71 million people who live with active hepatitis C, and there are 50,000 new cases each year in the world of hepatitis C. The best way to prevent hepatitis C is to avoid the risky behavior we talked about in terms of intimate contact and sharing of drug paraphernalia. There are some disease processes that are also associated with hepatitis C, like diabetes mellitus, glomerulonephritis, and non-Hodgkin's lymphoma, which is a cancer of the lymph nodes. For hepatitis D, as we mentioned, you can't get infected with hepatitis D without hepatitis B. So there are two ways that can happen. It's either a co-infection, that is getting hepatitis B and D at the same time, or a superinfection where someone is already infected with hepatitis B and then becomes infected with hepatitis D. So the best way of preventing hepatitis D is to prevent hepatitis B. And as we mentioned before, there is a vaccine that's available for hepatitis B. So the best thing that we could do for the liver when it comes to viral hepatitis is to prevent contraction. So getting clean water, better sanitation, getting vaccinated in the cases where we are able to do that. Avoid risky behavior in terms of intimate contact, sharing drug paraphernalia, making sure that we are protecting babies as they're being born, and when we're traveling, to make sure that we are being safe in ingesting food, in ingesting water, making sure we're boiling the water, making sure that we are doing a good job of sanitation. So our challenge to you for this video is education and action. So get educated on how to help provide clean water and better sanitation. If you know of places where there are moms who are suffering from hepatitis, who are pregnant, maybe a local clinic, lend your support to them by volunteering. If you know someone who has hepatitis, someone who's going through these symptoms, help provide some education for them. Maybe send them this video, maybe send them to one of the links that you will find in the description below. We appreciate you joining us. We appreciate you watching this video. If you've not already done so, go ahead and hit the subscribe button. Go ahead and hit the bell below so that you'll be alerted of other videos that we do. Give us a thumbs up, share this video with family and friends, and drop us a line in the comments below. If you have not reached out to us before, we'd love to hear from you. If you have hepatitis, if you know someone who has hepatitis, or if you just simply want more information or have a question, we would love to respond to you. Once again, thank you for watching. See you at the next video. This is Dr. Dwain Woode from Diabetes and Endocrine Wellness Center and the Light Away, educating the public for a better you.